All right. I don't know if you can see me. If you can, I'm Amy Locker. I'm the lead hearing and vision tech for Allegan County. And well, you can't see Abby, but Abby Arias is also a fully trained hearing and vision tech that we have with us. And welcome to the 2022-2023 school hearing and vision year. So we're excited. It's actually going to be 73 years for hearing and vision programs in Michigan. So that's quite a while. So we've been doing this. I've been doing this for almost 12 years. Abby's working on her second year. So I feel like we have a good team together. This is a state mandated program that provides hearing and vision screening services free of charge to all Michigan children. And it's managed by the Michigan Department of Health and Human Services. We've done over 1 million children screened each year with more than 88,000 referrals to either physician, eye care professionals, or follow-up related to hearing and vision issues. Both programs are standardized, so each child screen receives constant screening, referral, and follow-up service. So we're consistent with that. So this is just another thing saying that we're working with the Michigan Department of Health and Human Services, but I want you to look very carefully at the please note. So this is really important. Children should not be excluded from attending school if they don't have the required hearing and vision screening. If they have everything else, but they don't have the hearing and vision screening, we are allowed some leniency. What you should do is have them call the health department so they can make a screening, so they have a screening on the books, and then allow them entrance into school. So we actually have some upcoming screenings this month yet. We have screenings available the 24th, 25th, and 26th of August, and then September 2nd and October 7th. Those are on the website on our clinic flyer, so you can go there to find it, and I'll show you that later. But just so you know, there's still opportunities this month yet for kids to get screenings. So if they're not screened yet, just tell them to call the health department and that they should make an appointment and get screened and then continue on with entrance of school. All right, scheduling your school. So many of you will have seen this new scheduling form that we developed about a couple of years ago. If you haven't, we're going to go through it in just a minute, but you just complete that as best you can, email or fax it to us, either myself or Abby, or we're trying to start getting everybody more familiar with our new hearing and vision email, which is health-hv@allegancounty.org. So we'll start sending more stuff through that email to get you more familiar with it. I know I have to make that a habit for myself as well, because we didn't used to have that email. So that's something else that will be at the end. And then either of us will contact you with your scheduling needs for your school building. And then after we're done with that, we'll send you an email confirmation that will include a checklist and what we expect for our visit and what you can expect from us. And here talks about some of the things on our checklist. So what we're going to need from the school is going to be a quiet room that can seat at least 8 people for screening. A room that's 15 feet long, so when we're doing preschool screening, we have enough room for that. We're going to need a map of the school so we know where we're going. We're going to need some class schedules, so special schedules. If you have any math enrichment time where they're out of the room, reading enrichment time, recess, lunch times, we'll need to know that. If for somebody's having a field trip, we'll need to know that so we can make sure we screen them first or last, however it's appropriate. Then the next thing we're going to need to know is a nice class list that's going to have the student's name, their date of birth, mailing address, and phone number. We'll also need to know if there are any students that are hearing impaired or wearing hearing aids. And we need to know if any students have a shunt device, because we shouldn't be screening them at all. Then what you guys need to do to provide to the parents is just let them know that there's screening so that their students can know to wear their glasses or hearing aids on testing days. Also, it gives the parents an opportunity that if they needed to opt out, they can get an opt-out form and they can have a chance to opt out if that's what they wanted to do. So the important documents, these again will be able to be found on our website, which we'll show you at the very end. But the first one is the opt-out form, so you can do that online. We're also going to be starting to implement one online that we'll be able to do through a phone. We haven't quite got that worked out yet, but we will. And as soon as we have any updates, they'll always be pushed to our website. And then pretty soon, I think once our website is kind of revamped, we'll also be pushing out like updates that you can automatically get. So that'll be something to sign up for later, and we'll push that out as soon as we're have that done. The second one, the school scheduling form. So that's also on the website, and you'll be able to do that. The important thing is that sometimes it's kind of hard to remember is that even though you might have, your school might contain like a GSRP, I just need to know that there's a GSRP there, because while we're at your school, we'll also include them if you have some preschool that's not connected to the school, but in the school building, because we like to do those while we're there. So we need to make sure we allow enough time and we connect with those teachers. So that's one of the things to kind of be aware of, because that helps us figure out how much time we're going to need. And then the last one is the Vision Clinics schedule. This is not the most updated one. There is an updated one on the website currently that does give those additional dates for this month. So that is there as well. So then this just covers what we do when we're doing preschool screening. Again, we are taught by the state, and with them, they do a lot of standardization. So all our tests are the same kind of test, and they're very standardized the way that we're taught. So our criteria for referral for vision is going to be at the preschool level. If they cannot see with either eye 20/40, that will be an issue. If they have where they're at smaller, like 20/25, if they can see with one eye and not the other, that would be an issue, and that would signal something to go home for a referral, as well as if they were unable to see the stereo butterfly correctly, because that would indicate there might be a muscle issue, that would send a referral home. So all of these things that we do are recommended referral criteria. We are not diagnosing there's an issue with the child. We're just saying, hey, these send up red flags, and we should probably go have that checked out by an eye care professional. So once the child is in first grade, then they're going to go to a different screen technique, which is instead of the Leah cards, they're just going to use the VTech screener. And we're going to do the same type of test. The FORIA test would be equivalent to the stereo butterfly test. So that's going to show if there's any muscle issues. Then we're going to have the visual acuity test, which after first grade, it's going to be 20. We expect them to be able to see 20/30 out of both eyes. And then we'll still have that same 2-line difference to make sure that at smaller acuities, they can still see the same through each eye. So there's not one that's significantly weaker. Then for the hearing, we have 3 different stages we usually do. We do the initial test, which we do while we're doing the vision test, usually like at the same time at school. That's going to be for kindergarten, 2nd, and 4th graders. I'm sorry, I forgot to mention the vision is for 1st, 3rd, 5th, 7th, and 9th, and then preschool we do both. But for hearing screenings, we're going to do 6 tones, 3 in each ear. And if they pass all those, they pass. If for some reason they miss one, we wait a whole month, at least 4 weeks. So that way, if they did have fluids in their ear, they would clear up. And then we do a more extensive test for 12 sounds, 6 in each ear, to see if they pass those. If they pass all those, they're good. If they don't, we would do a full audiogram, in which case they would need to be referred to a specialist to see what was going on. So this is just another mention more in depth about the programmable shunts. And this just kind of gives you the reason why we wouldn't be screening somebody with programmable shunts, because sometimes that can cause issues with their devices. Our headphones have large field gradients, so it can mess up with programmable magnetic shunts. So that's one of the reasons why. And that's why we always ask if there's someone you know that has that they can put on a list, so we can be made aware of that. Then this is just a reference guide. If you don't have one, you can get one. They're also in the MICR in the back, but it's just to tell you how to put in the vision screening for like kindergarten entrance. So that is what that one is. Then this is kind of all the things for the public health code. If you click on one of the sections, it'll like unfurl itself, and then you'll see like which part of the Michigan codes that it's under and what that all says. So that's what that is if you want more in-depth reasoning for that. The next thing is going to be kind of about the FERPA, and I know Aaron did mention it. This kind of just goes more in depth if you actually like Okay. I'm not going to click on it because I don't want to get out of the presentation because I would probably not have a good experience with that. So if you click on it though, it'll unfurl to quite a bit more and you'll be able to see all these different things if you really have a lot more questions. And basically it's just to let you know that we are allowed without consent for directory information of a student's name, telephone number, date of birth. So that's kind of what that is. There's more in-depth information there if you need it. If you have any questions, you can call me. I'll help you with that. Then this is just our contact information. That's my name up there. And then Abby is there. So she would help you as well with scheduling. And that is our program email that I'm going to try and start sending everything through, and a secure fax line to send any information we have. So that is kind of what is going on there. Then we have, this is our state program. So that's the information there. That is for MICR, so that's how you would do the reporting for kindergarten entrance, and that is our website. And again, once you go to that website, you click on health, you go down to personal health, and then hearing and vision, and then you would see all the documents I showed you earlier. And because this is a little glitchy, I'm not going to do this like I originally was going to. So if there's any questions, feel free. Otherwise, I will be calling many of you in the future because we are just starting their scheduling process.
Us and see Amy and the display.
Arrow down, that's it.
Arrow to the right is how you can.